Welcome, everyone. We have, I think, just about an hour and some time for questions if anyone has any at the end or any discussion points. So my name is Chandra Bruval. I'm the Communications Manager at AlphaHouse Society. We're a nonprofit charitable organization in Calgary. We also have programs operating in Lethbridge as well, but we have the bulk of our programs here in Calgary. We, for those who don't know, operate a shelter and a detox program in downtown Calgary. So we're on 15th Avenue. So right across from Stampede Park is where our shelter and detox program is. And our shelter is on the bottom. And our detox program is on the second level of that facility. And so that allows us to support folks who are coming into the shelter straight up into detox if that's something that they're interested in. AlphaHouse's work is specifically around homelessness and addiction. So we specifically work with folks who are active substance users, and we support them towards, greater stability. And when we talk about stability, that's a number of different things for lots of different individuals. And we'll talk more about that as we go. AlphaHouse also has housing programs. So we're in 8 different communities across the city. And we have both place-based housing, which is, an apartment complex, and fully staffed 24/7, and all of the individuals or all of the tenants in those buildings are AlphaHouse clients. And then we also have community housing, which is, rental market housing. So somebody rents a basement suite or a second floor bachelor suite or something, but they have a caseworker. So they live independently, but they have access to supports just to help them manage some of that everyday stuff that maybe you or I take for granted, changing light bulbs or guest management or basic hygiene or things like that. We also have outreach programs, which most people are familiar with if they are familiar with AlphaHouse. So we have an encampment team that works with people who rough sleep, or so when you see tents out and about, those are folks that our encampment team works with to connect them to housing options. Our needle response team picks up needle debris, so discarded needles or syringes and things like that, private and public property across the city. And then our DOPE team, Downtown Outreach Addictions Partnership, is a program focusing on transporting folks who are in a space where they maybe shouldn't be or that's not safe for them, and we support them to get to a shelter or a housing program or a hospital or things like that. We also have our ambassador program, which isn't up on this slide, but that does support Chinatown, specifically working with businesses in Chinatown, 17th Ave and Victoria Park areas, just around homelessness and substance use and how we can, support businesses to interact with clients a bit more easily, and maybe, just a more cleaner, safer community is the goal. The goal for today's training is to just learn about addictions and homelessness and mental health and kind of how they intersect. And it's also to talk about some of the stigma and personal biases that we have towards folks who are unhoused, and just allows us to feel a little bit more comfortable with understanding somebody's, state or why somebody is in the situation that they're in, and then how we can interact with them a bit more meaningfully or positively, or be less scared when we do see folks on the street. So we start this presentation by talking about the addictions and substance use piece, because AlphaHouse's lens is from that addictions standpoint. So all of the folks who access our shelter, the people who are in our housing programs, they are specifically folks who are struggling with addiction. And so our lens is always from how homelessness and how addiction kind of intersect. It's not true to say that everybody who's on the street is, using substances, but there is a population, a subset of that population that does use substances and is unhoused. So that's the focus of AlphaHouse's work. When we talk about addictions, we try to talk about both recreational drug use and the stigma associated with different types of drug use. So when we talk about alcohol in our society, it's typically spoken about very casually, and there's not a lot of stigma associated with alcohol use. And actually, when we talk about alcohol use, a lot of the time, in different cultures and in different societies, it's unusual if you don't indulge in alcohol use. If you're at a party or some get together, it would be weird, right? People would find it, oh, I wonder why that person's not drinking, not having a glass of wine or, a beer or something like that. That's very, very common in our society. Even though, from AlphaHouse's perspective, the number one substance use that we see in terms of the folks that we serve is alcohol. And so even though there's not a lot of stigma associated with alcohol use, it is still one of the most destructive in terms of, people's lives, in terms of their relationships, in terms of their health. And alcohol withdrawal is actually one of the most dangerous substances to withdraw from, because that can cause death, in significant amount of cases if it's not properly managed. So when we talk about perception of drug use, we have a very different perception of someone's alcohol use than we do of somebody who, say, is, on opioids or methamphetamines or, cocaine or something like that. We have a very different view of that. And it's just a point of discussion. It's something to kind of think about. A lot of this presentation, a lot of this workshop is just really about sort of changing the way that we're thinking about substances, and why we have, why we're okay with, this rowdy group of, young adults who are, at a bar drinking. We have more kind of compassion for them than we do for somebody who's on the street, who's using substances. And that is often just based on our perception of that person themselves, right? We think, well, this person has earned the right to have a beer or to have alcohol, whereas this person, they shouldn't be allowed to use substances because they, or they're on the street and they're, they're causing problems, etc. So just again, a discussion point in terms of different types of substance use. From AlphaHouse's perspective, we operate from a harm reduction lens. Harm reduction is just a principle, a concept of reducing the negative consequences associated with using something. So we use the example all the time about, driving a car. Driving a car is risky, right? There's risks associated with getting behind the wheel of a vehicle or being a passenger. There's a significant amount of motor vehicle accidents that are fatal across North America every day. But we as a society still utilize cars often, right? Or even public transit, right? We get in these motor vehicles or these vehicles that can kill people. And so as a result, we have, as a society, said, okay, we're still going to do this thing. So let's try to reduce the consequences, the negative consequences or side effects of that thing. So we have speed limits. We ask people to wear seatbelts. You have to get a driver's license in order to drive, et cetera, et cetera. And so that idea is the same concept when we talk about harm reduction for substance use. So for the folks that AlphaHouse works with, a lot of the time people might not be able or willing to stop using substances. And that can be a really confusing concept for a lot of people, because a lot of the time we look at somebody who's on the street, who's homeless, who's, struggling with their addiction. And we think, well, if they were just able to get help, if they were able to get into a detox program, then that would sort of solve those problems, right? But what we know is that a lot of the time, substance use stems from trauma, right? And so it's not always just an easy thing for people to stop using. In the same way that we talk about cigarettes, right, which is an addictive substance or addictive activity, it's very difficult for people to stop smoking cigarettes, right? And that's not even, the same addictive level as something like methamphetamines or fentanyl or things like that. And so our role at AlphaHouse is not to judge somebody who is using substances, but to support them to use more safely and to improve their circumstances. So manage their substance use until they're in a place where they can maybe go into a detox program or ask for recovery or things like that, right? We want to keep people alive and healthy long enough for them to be able to make different choices, right?